apologise. Dean Russell.
Thank you, Chair. And can I also express my thanks to you, Professor Whitty, and the team for everything you've been doing, a momentous effort over the past few months. My questions are related to the vaccine. Obviously, there's been some really great news this weekend over the past few weeks around the success in trials around the vaccine. I've just got a few questions around the practicalities of that moving forward. So first of all, a question I asked to the witnesses earlier, have you got a sense of what percentage of the population would need to have the vaccine for it to be truly effective across the country, please?
So I'm hoping that Professor Van-Tam is on the line. If he's not, I'll answer it. But if he is, then he will.
I believe he is. I can see him at least. You need to unmute Mr. Professor Van-Tam.
Oh, it's in my hands to unmute. Good afternoon. Thank you. Yes. So you're asking a question about how much of the population we would need to vaccinate in order to have a good effect. And of course, I can chop that into several different ways, and all of which are valid and all of which are important. The first thing to say is that we may end up in the first instance with a vaccine that is most appropriately targeted and which has a label that restricts its use to a certain population. Shall we say, for argument's sake, and this is purely for argument's sake, age over 50. Now, a regulatory body may take that view, and it would always take a view based on risk benefit. And as we know with this disease, the likelihood of death changes very markedly with age. And so the risk benefit for a vaccine is likely to be very different by age. There may also be some other considerations, for example, data that show a particular vaccine does not work in the very elderly, or has some other limitation to it, and so that may constrain who we can give it to. The next point then is about how effective that vaccine is going to be, and vaccines do range in effectiveness. Shall we say from the flu vaccines, typically 40 to 50% in a given year. That seems low, but it's a very important public health benefit, through to, shall we say, hepatitis B vaccines, which are highly, highly effective. And so from that perspective, we don't know until we get it how effective it's going to be. But the JCVI has done some work in this area already, and using a new algorithm has looked at the likelihood of suffering a complicated or fatal outcome from COVID-19, and looked at the characteristics of patients. And if we could even vaccinate the top 20% of that risk scale of adults from the age of 19 through to the top end of the range, then we would be dealing with the age group in which almost 90% of the mortality is currently loaded. So from that perspective, you would only take out all of that mortality if you had a vaccine that was 100% effective. But I can say that targeting a relatively small proportion of the very highest risk will deal with a very large amount of the population who have the mortality loaded against them at the moment.
Thank you. Excellent, thorough answer. I've just got two or three very, very brief points, which I'll wrap into one question. Just in terms of some of the comments I've had from people coming in my inbox have been, firstly, do you see a point, and this is Professor Whitty or Professor Van-Tam, do you see a point where it will be a legal requirement to have the vaccine? Secondly, do you see it being a point where it's going to be free, or will there be a prescription required? And thirdly, related to that, I've heard a lot around the flu jab and the fact that it's going to be a flu jab obviously needed shortly for the winter. Do you see an opportunity to perhaps combine flu jabs with doing the vaccine trials? So I'll throw those.
I'm afraid we're only going to have time for Professor Whitty, with great apologies to Professor Van-Tam on that one, just because we're coming up against the clock. But Professor Whitty.
Thank you. Apologies.
legal requirement, I would very, very much doubt it. Finally, that's a decision for ministers, but forcing people to have vaccines does not strike me as a good answer under any circumstance. And to go back to previous point that Professor Van-Tam made, we may well get a vaccine that in any case protects the individual but has no benefit to society. It's simply to protect the individual, in which case it's entirely a matter of choice as to whether someone wishes to be protected against this very potentially significant disease. That's a policy decision, but I would personally expect it to. And in terms of combining flu with this, if we were lucky enough to get a vaccine, and this is an area where Professor Van-Tam, if you want more details, is really expert. But if we were lucky enough to get a vaccine in time for the winter flu season, then of course we would be wanting to try and do both. But we are some way away from that. And I want to be very clear, we're incredibly excited by and proud of what the UK has done in leading the way on vaccine science here and on funding vaccines elsewhere, and excellent work by many people for securing potential vaccines. But no one should be under any illusions. The chance of us getting a vaccine before Christmas that actually is highly effective are, in my view, very low. I think JVT, Professor Van-Tam would probably be a little bit more optimistic than me, but I think both of us would say low probability for this winter flu season. JVT, do you want to?
We would
yes,
we would love to hear more. Okay, brief answer, Professor Van-Tam.
So I'm cautious. So I'm cautiously optimistic that we will have some vaccine this side of Christmas. If we do, we will not have any data on whether it can be given at the same time as flu vaccine, and likely we will have to delay or separate those two vaccines apart in terms of the staging in which we give them to the relevant patients. It is a utopian dream. It will be wonderful if one day we can have a combined COVID-19 and flu vaccine in one syringe, because of course it's the same target group. But that kind of vaccine development is going to take many, many years into the future to achieve.
Thank you.